Hi, hello everyone. So I am one of the students here at LaGuardia, and today we're going to be doing a video on SubQ injections, and this is one of the skills that you guys are going to have to execute and do it as I show. So the first thing that we're going to do is we're going to go to our COW, computer on wheels, and we're going to look at the medication administration record, and also we're going to look at the doctor's orders. We're going to look at these two documents and make sure that we verify the patient's 5 rights. So first thing is the right patient. So our patient is just a newlywed. And I'm going to compare with the MAR, just a newlywed, the doctor as well. And then from here, we're going to verify the medication. So we're going to give a SubQ regular insulin. So we're going to look down here at the medication administration, regular insulin. She gets it 4 times a day, and I verify it by looking at the doctor's orders. Blood sugar 4 times a day. First dosage is at 8:30. And the dosages is dependent on the sliding scale. So that, we look here, so it's based off whatever her blood glucose is at first thing in the morning. So let's say it's 215. That's within this bracket here, so it's 4 units in the morning. So that's the right patient, the right medication, right dosage, right time, and the right route, which is SubQ. And then from here, we are ready to gather our equipment, but before so, we're gonna perform hand hygiene, sanitizer, right, or washing your hands. And then from here, we're going to log into the cart, scan the student ID code, hover just in newlyweds, make sure that we are clicking on the correct patient, which is just a newlywed. That would be number 4. And since we're reaching for the medication, once I grab what I believe is the correct medication, we're going to compare with the MAR. So regular insulin is where we're going to perform our first check. So regular insulin, and yes, that's our first check. One thing that I forgot to mention is that when you're verifying the 2 documents, along with the 5 patient rights, you also want to make sure that there's a signature at the bottom, okay? So from here, I'm also going to grab my alcohol wipes and my insulin syringe. So remember, insulin for orange cap. Take that down. And before preparing, we're going to perform our second check. So again, regular insulin, and then from here we're ready to prepare our equipment. So I'm going to grab the alcohol prep pad, wipe the top of the vial, and before that we did the second check, right? So now I'm going to grab my syringe, open it up, and we're going to make sure that we maintain stability of the syringe by only grabbing the plunger, which is the top part, right, and the barrel of the syringe. What cannot be touched is the inside of where that plunger is, because that goes within the tube, which can break stability, right? So from here, I'm gonna just withdraw 4 units of air. Why? Because I need to put in 4 units of air into the vial before I withdraw the medication. It just helps with correctly getting your dosage. So I'm gonna remove the top, place the cap right down here. Gonna verify I have 4 units, yes I do. And now I'm going to inject the air in, then I'm gonna flip it on its head, right? And I'm going to withdraw 4 units of insulin. From here, I'm gonna just do another check, make sure what I withdrew is in fact the regular insulin, looking at the MAR, it's 4 units, perfect. Place that down. You see this little orange syringe stand here? You can, if it's an IM syringe, you can literally just plop it in there, but this won't fit. So we're just gonna put it right in the orange cap. This is not technically recapping, okay? Just for clarity, do not recap your needles. But I'm placing it on there just so I know that it doesn't touch any other surface. And then from here, we can either perform our third check here before cleaning up and everything, or we could do it at the bedside. depends on you. I like to do it right here. So again, regular insulin. Our third check is done. And if we clean up, and then we're ready to go to the bedside. Okay, so now we're ready to walk into the patient's room. All right, I'm gonna walk in, knock my presence, right? And I'm gonna say, hi, my name is Manny. Can you please tell me your name? Oh, my name is Justin Newlywed. Right, okay, my name is Justin Newlywed, and from there, I'm using the patient as a source, and I'm also gonna use the ID band. I'm gonna verify what they said. Oh, my name is Justin Newlywed, perfect, Justin Newlywed. And then can I have your date of birth as well?
011111.
Right, and then I'm gonna use that information and verify with MER and make sure that I have the correct patient. All right, and then we're also gonna scan the patient's ID and they're verifying that we have the right patient. So, okay, so I'm here to give you your insulin this morning. This is to control your glucose. So another thing is you want to make sure you let the patient know what it is exactly you're going to do. We're giving insulin, so I'll let them know some of the implications about that and go over some of the education. So I'll say something like, oh, I noticed you have food here. This is perfect. It's really important that we have food readily available when we're giving regular insulin, because if not, we can risk a hypoglycemic effect. And then another thing is you want to verify if there's any allergies with the patient, right? So you can ask them, hey, so is there any allergies that I should be aware of? Any food allergies, any medication allergies? Because insulin can be allergic to the patient. To verify no, perfect. So from here, another thing that we start doing is we start verifying or deciding where to give the injection. I like to make the patient a part of this. So I'll ask them, hey, so is there any particular place where you want the injection? So subcutaneous layer, there are a couple places where you normally get this. So this could be under the arm here for the fat tissue, right? So on the arm, on the underarms here, and the leg. Most common is the arm. However, the fastest absorption rate would be the stomach. But yeah, you want to make them a part of that, right? So you ask them, is there any particular location you would like your injections today, Miss Newlywed?
I would like the arm.
Okay, perfect. So made them part of it, and we're going to simulate that here. So from here, you perform hand hygiene, put on your gloves. So let's see, we have some cells. So after you perform hand hygiene, put your gloves on. Now that you have your insulin already prepped, from here is just a matter of executing the injection. So you're going to grab your needle, make sure that it remains sterile, and you're also going to grab your alcohol prep pad, second one, and you're going to grab this and sanitize the location in a circular motion from small circle to big circle. And from here, the angle is dependent on the adipose, the amount of fat on the patient. So if the patient is thin, you want to use a 45 degree. If the patient has a lot of adipose tissue, then you want to use a 90. So for this instance, we'll say that the patient is thin. So again, you have a thin patient, so we're doing a 45 degree angle. And another thing is, for subcutaneous, you need to verify that the bevel is up, and that's where there's a slant on the syringe that's facing towards the ceiling. That's how you know that you have the correct placement of the syringe, okay? For IM, it doesn't matter, but for SubQ, it does. So we're gonna grab and pinch at a 45 degree angle. So you're gonna go in, squeeze, and then come out and grab the alcohol prep pad. So again, like so. Grab the alcohol prep pad. Do not massage, just a gentle pressure on there for a few seconds. All right, so after we give the injection, we're going to activate the safety on the needle. And then from here, we can throw it away in the shark, okay? We can look at our patient, make sure that they're okay. So how are you doing, okay, Miss Newlywed?
Doing good, thank you.
Okay, perfect. Start removing our stuff, start cleaning our area. And before so, we ask the patient, is there anything else that I can do for you, Miss Newlywed?
No, I'm good for now, thank you.
Okay, great. So from here, the last step is to clean and then document the procedure. Thank you, guys.